Dear students, good morning. This is the lecture class of Radial and Axillary now. The competency number is given. You can see that. The next one is the learning objectives of this class. At the end of the class, the phase 1 student, you people, will be able to describe the formation, course, and branches of radial and axillary nerve and describe the clinical condition called Saturday night palsy and the axillary nerve injury in detail. Okay, these are the clinical applications of radial nerve and axillary nerve. And the next one is, look at the first picture, a person who goes to the pub in the Saturday night. After coming from the pub, he has taken alcohol and while sleeping on the armchair, see the posterior aspect of the arm is getting compressed. You can see that. So since he has taken alcohol, he was sleeping for a while. Okay, longer period. So what happens the next day morning? Next day morning he is not able to extend his wrist. This is called as wrist drop. Okay, so here it is given as a clinical condition called Saturday night palsy. So what is Saturday night? Why is it called as Saturday night? Is usually people they go to the pub and they used to take alcohol during Saturdays. That's why it is called as Saturday night palsy. Okay, this is because of what? What is the cause for this? What is the reason for this? That and all we'll be seeing it in the next slide. Then look at this picture. This is scapula. Hope you can visualize the scapula. This is the X-ray picture, and this is the head of the humerus. And here is the surgical neck of the humerus. And look at this. This is the glenoid cavity, and you can see the humerus gets displaced inferiorly, and it is not articulated well inside the glenoid cavity. It is called as dislocation of the shoulder joint. So this inferior dislocation. So what could be the nerve injured in this case? This is this patient's X-ray, and you can see this patient. He could abduct his upper limb for 15 degrees only. Beyond 15 degrees, he is not able to abduct. So what is the clinical condition? What is this clinical condition? So will you be able to correlate? If you could correlate, it would be nice. This is a very important clinical scenario question. So inferior dislocation of the shoulder leads to loss of abduction and there is loss of sensation over the deltoid. So these two are the clues. What is the reason? We'll see. Look at this. This is a basic knowledge that the student should have before learning the radial nerve and axillary nerve. So first you can see the diagrammatic representation of the bony landmarks. Spine of scapula is here and the head of humerus is articulated with the glenoid cavity here, and you can see the humerus and radius ulnar bones, and here you can see the muscles. So the first number 2 muscle is, everyone knows what is this muscle? Deltoid, yes, correct. This is deltoid. So, and here the posterior compartment, here you have a muscle called triceps. You can see the tendon of triceps getting inserted into the olecranon process. You can see the third one is olecranon process. So, this triceps is getting inserted into the olecranon process. It's a very important thing. And you can see the glenoid cavity. You can see the infraspinous fossa here 7. So, this is infraspinatus muscle is shown here and radius ulna, both of bones you can see here. Look at this. This is deltoid, and here you have spaces. So you can see the spaces here. This muscle is here, triceps. Triceps has 3 heads: long head, lateral head, and medial head. So here is the tendon of triceps. The triceps is getting inserted into the olecranon process. In the previous slide we saw that. And here you can see the beautiful intramuscular spaces. So number 1, this is upper triangular space and this area is quadrangular space and this is lower triangular space. So we'll see one by one. Now among the 3, we want, for the radial nerve purpose, we want this lower triangular space. Before going into the lower triangular space, we must know the triceps muscles in detail. 14. Number 14 is long head of triceps. This one, the cut end. 13 is lateral head of triceps. And below this radial groove, you can see the radial groove. Below that, you will be having the medial head of triceps. So whenever you see this origin of these three heads of triceps, the long head originates from infraglenoid tubercle, and this one, the lateral head, originates above the spiral line. Above the spiral line, this is the spiral line or radial groove or spiral groove. This spiral groove only, you have the radial nerve and the profunda brachii vessel. And above the spiral groove only, the lateral head takes its origin. Below the spiral groove or radial groove only, medial head takes its origin. And then this is long head. All these three heads together forms the triceps. So you know the lower triangular space contents. For that, you need to know what few muscles in and around the space. Number 11 is teres minor. Number 10 is teres major. 14 is long head of triceps. And here is the bone humerus. Now, the upper triangular space is here. Circumflex scapular artery is nicely seen. And this is the quadrangular space. These two spaces are important for today's class. And here are the boundaries of quadrangular space. Superiorly teres minor, inferiorly teres major is going up to this, and then medially you have long head of triceps, and laterally you will be having the surgical neck of humerus. So immediately when I talk about the surgical neck of humerus, you should come out with the answer. Axillary nerve is winding around this area. So the content is axillary nerve along with posterior circumflex humeral artery. This is a very important MCQ. So the quadrangular space contents are axillary nerve and posterior circumflex humeral artery. Now the next question arises, since axillary nerve is here, this axillary nerve is related to anteriorly a muscle, posteriorly a muscle. So anteriorly you have triceps and posteriorly you have teres minor. So these two are important. You keep it in mind when you read about the axillary nerve in detail. And then when you are here in the lower triangular space, superiorly it is teres major and medially long head of triceps, and laterally you have shaft of this area, shaft of humerus. So here I mentioned surgical neck of humerus. Here I mentioned shaft of humerus. Shaft is the mid portion of humerus. There only posteriorly you have the radial groove. So this is enough for this picture. And next comes the beautiful spiral groove here, and you have the cut end of the muscle. You can see inside nicely it is shown as medial head of triceps. I said this is the groove. Can you see the groove? And below that you will be having the medial head of triceps, and above that you will be having the lateral head of triceps. And this long head arises from the infraglenoid tubercle. So this is very important. All the three muscles you must be thorough. And a beautiful picture showing the radial groove with the radial nerve and spiral groove along with profunda brachii artery. So this is very important. Definitely this will be asked in the spotter also. So you must be able to answer for this. And the beautiful deltoid you can see, and behind triceps you can see. If you come down, you have a beautiful muscle just below the olecranon. This is called anconeus. This is a fan-shaped muscle number 2. It is called anconeus. So when the radial nerve lies in the spiral groove, it supplies three muscles. What are the three muscles is the question usually be asked. So that is one lateral head, medial head, and anconeus. That we'll see later. Now you just locate the structures what is present here, deltoid, triceps, and anconeus in this picture. Next comes, you can see the beautiful picture, again the radial nerve and spiral groove. And this side if you see, and the deep muscles, see the radial nerve, initially it was present in it is lying near the axilla, where when it comes out of the brachial plexus, it is arising from the posterior cord of brachial plexus. That time it is near the axilla. After that, it enters into the spiral groove. So spiral groove, it lies between the lateral head and medial head muscles. Down it comes near the anconeus. So it is in the spiral groove area. After that, the radial nerve near the epicondyle. Okay, here is the epicondyle. You have the lateral epicondyle. The lateral epicondyle, near the lateral epicondyle, divides into superficial branch and the deep branch. You can see the beautiful deep branch. It goes inside and pierces a muscle by the name supinator. Okay, what is this muscle? Supinator. After piercing supinator, the deep branch is called as posterior interosseous nerve, because interosseous means in between bones. So this lies between the radius and ulna. That's why it is called as interosseous nerve. Since it is on the posterior side, it is called as posterior interosseous nerve. So it is a beautiful picture showing the posterior interosseous, and then it supplies all the deep muscles. So you must know the muscles of the posterior compartment of arm. For that, you need to know the three muscles. Number one is brachial. This from the lateral epicondyle. So starts from here, brachioradialis, extensor carpi radialis longus, and this third one is extensor carpi radialis brevis. So three muscles on the lateral side, and then anconeus I have already showed you, superficial muscles, and then the big one, the tendons. Can you see multiple tendons? Number 6. This is for the digits, so it is called as digitorum. And the final one here in the ulnar side is extensor carpi ulnaris. So these are the muscles you can see on the superficial part, first layer muscles. So 1 brachioradialis, 2 extensor carpi radialis longus, 3 extensor carpi radialis brevis. But in the flexor compartment, we have only flexor carpi radialis longus, flexor carpi radialis alone. But here, instead of 1, here you will be having extensor carpi radialis longus and brevis. And the digitorum 6 and extensor carpi ulnaris. These are all superficial muscles. When you reflect all the superficial muscles, you could see the deep muscle number 1, supinator. Number 2, there are two muscles coming out like this. Abductor pollicis longus. Here also you can see abductor pollicis longus. And the second one is extensor pollicis brevis. And the third one is extensor pollicis longus. And the fourth one is extensor indicis. Okay, in this digitorum tendon, the superficial tendon, when I mentioned that time, you should include one for the little finger, that is extensor digiti minimi. So again I repeat, the deep muscles are supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. These are the deep muscles. Rest everything is a superficial muscle. Okay, posterior compartment of arm. Here you can see clearly, okay, the three, again I repeat, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, okay, 3 over on the lateral side. These are all superficial muscles along with anconeus, and then digitorum, digiti minimi, you can see the thin one, digiti minimi, and then extensor carpi ulnaris, finished. And the deep muscles are supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. So these are the muscles you can see in the posterior compartment. And when you come down here, here is a something called a snuff box. You can extend your thumb and you can see the depression there. That is called a snuff box. This snuff box is here. Over that you can see the superficial branch of radial nerve comes nicely and spreads over here and gives digital branches. You can see the lovely digital branches. One digital branch goes to the lateral side, another one comes to this side, 2, and then third one goes towards the radial side, 3, and then fourth digital branch goes the midline and then supplies both the sides, and fifth digital branch goes here and supplies both the sides. So totally 1, 2, 3 and 4.5 fingers are supplied by the superficial branch of radial nerve, which gives rise to digital nerves. Okay. Now overall view we have got. With that, I will enter into the formation, course and termination of branches of radial nerve. So formation, everybody knows, all the posterior division of the brachial plexus, they join together and forms the posterior cord. So this arises from the posterior cord. So 5th, 6th, 7th, 8th rami, occasionally 1st. This forms the origin. So 1 mark will be given for that. Second, the course. So first is radial nerve in the axilla, second radial nerve in the spiral groove, and radial nerve near the lateral epicondyle. And then there only it divides into two branches. One is called superficial branch, another one is called deep branch. This is how you should learn the radial nerve. Okay, these are the important things you should write for the course. Radial nerve in axilla. Axilla, it is related to the axillary artery. Just below the axillary artery, it lies in the axilla. First point. Second point, next picture we'll see. Between the coracoid process and the spiral groove, that is radial nerve in the axilla. Radial nerve in the axilla lies beneath the axillary artery, the most important one. And then next one, branches in axilla. Branches in axilla, it gives branches to long head of triceps because long head of triceps arises from the infralinear tubercle that is on the top, okay, near the scapula and the glenoid cavity. So it is supplying the long head of triceps, and another one branch to the medial head of triceps. And the cutaneous branches are posterior cutaneous branch of arm. Okay, so all of you see your arm, posterior part of the arm. It is related to the upper part. So the axial radial nerve comes over there. That's why it supplies the posterior cutaneous branch of, it gives posterior cutaneous branch of arm. That's very important, arm. Look at this. This is what we were talking about. And this is the spiral groove area. Initially, I was talking about the long head, okay, and this is long head, and here is the medial head. So when it lies in the axilla, it supplies the long head, and one branch comes here and supplies the medial head. Understood? So that's why we said two muscular branches when the nerve lies in axilla. But when the nerve lies in the spiral groove, these two are getting its supply from that. One is lateral head, another one is medial head. Down if you come, you have anconeus. So all the three muscles, they get its supply from radial nerve in spiral groove. Okay, so radial nerve in axilla supply is different. Radial nerve in spiral groove supply is different. And here there are two cutaneous branches. One is called as posterior cutaneous. It's coming up to this. So down. So posterior cutaneous nerve of forearm and then lower lateral cutaneous nerve of arm. So again I repeat, when it comes near the axilla, it supplies posterior cutaneous nerve of arm. It gives posterior cutaneous nerve of arm. But when it comes near the spiral groove, it is very low. Okay, lower part of the arm. So it gives lower lateral cutaneous nerve of arm and then posterior cutaneous nerve of forearm. It is going down to the forearm. So these branches are very important for the MCQ. Next is when it comes near the lateral epicondyle, 3 finger breadth above the lateral epicondyle and 1 finger breadth distal to the lateral epicondyle and 1 finger breadth superior to lateral epicondyle. It means it is nearby the lateral epicondyle simply. So it supplies brachioradialis here and extensor carpi radialis longus here, extensor carpi radialis brevis here. So all these three branches are given near the lateral epicondyle. So student must know all these things. So when it comes in the axilla, what are the branches? When it is lying in the spiral group, what are the branches? When it lies in the lateral epicondyle, what are the branches? And the next comes the superficial branch. I have already explained you about that. Superficial branch, it comes over the anatomical snuff box. This is MCQ. This is an area called anatomical snuff box. So MCQ number 1, the roof of the anatomical snuff box, we have the superficial branch of radial nerve. After that, it divides into dorsal digital branches. One branch to the lateral surface of thumb, another branch to the medial surface of thumb, another branch to the radial surface of index. Another branch comes near the web space, this interdigital space, and divides into two, and then both the sides of the index finger and the middle finger. And the fifth branch comes here. Again, it divides into two. One branch to the index finger, middle finger, and a branch to the ring finger. But when the student writes about the distribution, they should write the first dorsal digital branch to the thumb goes up to the nail bed. Concentrate, up to the nail bed. means it comes up to the nail bed. Nail irukilla, nail bed. The second one, it goes up to the middle of the middle phalanx. Middle of the middle phalanx. And the third one, we'll take this third one. Okay, the third one, proximal phalanx, and here also it goes up to the proximal phalanx. So first one goes up to the nail bed, second one goes up to the middle of the middle phalanx, and the third one and the half finger, all these things only proximal phalanx. So what will happen to the upper part here, and what will happen to this part which nerve is supplying here, and what happens to this part? All these are supplied by median nerve. And then this lateral 1.5, this entire lateral 1.5 is supplied by ulnar nerve. So the distribution is very important. So among this, which finger has all the three nerves supply is this ring finger. Okay. Here radial nerve, upper part median nerve, this lateral part ulnar nerve. This is MCQ. So you must know about this. Next comes okay. This is about, I have already explained you about the muscles. So the previous slide was muscles and this is wrist drop. So when the nerve is injured, either in the axilla or in the spiral groove, it will lead to the all long extensor muscles paralysis. This leads to the person will not be able to extend the wrist. So what will happen? It will lead to wrist drop. So this condition is called as wrist drop. So you must know this. Next, I'll move on to the axillary nerve. Axillary nerve, posterior cadaveric plexus. Look at the root value. And first it lies in the quadrangular space. When it lies in the quadrangular space, it innervates deltoid as well as teres minor and the skin over the deltoid. That is very important. We'll see what will happen. See, look at this. This is the axilla. Here is the radial nerve, goes back, quadrangular space. This is deltoid. This is the surgical neck of humerus. This nerve winds around the surgical neck of humerus. So when it winds around the surgical neck of humerus, obviously it supplies the deltoid. Behind that, you will be having the, look at this, winds around here. So you can see, so the formation is from the, it is formed from the posterior cord of brachial plexus. So next comes the it originates, it is formation, both are same only. So you can tell us it is formed from the posterior cord of brachial plexus. That's the correct option. And then axillary nerve comes and lies in the quadrangular space, winds around the surgical neck of humerus. It divides into two branches. One anterior branch, another one posterior branch. Anterior branch supplies the deltoid and the posterior branch supplies the teres minor. And the cutaneous branches, upper lateral cutaneous nerve of arm, upper lateral, this area. Lower lateral, already I have told, here is a spiral groove. So the lower lateral is supplied by the radial nerve. Upper lateral is cutaneous nerve of arm is a branch from axillary nerve. Common sense. It lies over the deltoid. And then goes, look at this, already we explained, this lies in the quadrangular space. Quadrangular space axillary nerve comes here. So anterior and the middle fibers are supplied from the anterior branch and posterior fibers of deltoid along with teres minor is supplied by the posterior branch of the nerve. And once it supplies the teres minor, it forms a pseudoganglion. That is very important. Pseudoganglion. So this is very important. And anterior branch, posterior branch supplies. Name the cutaneous branches. I have already told, skin over the deltoid. That means upper lateral cutaneous nerve of arm. What is pseudoganglion? The posterior divisions after supplying the teres minor, it ends as pseudoganglion. Same way, radial nerve also, the deep branch after supplying the deep muscles, it goes to the fourth compartment of extensor retinaculum and forms a pseudoganglion. So radial nerve also forms a pseudoganglion. Axillary nerve also forms a pseudoganglion. That is a very important MCQ. And here it is nicely shown picture how these two nerves are anterior division and posterior division goes. And this is a summary of axillary nerve. So the first slide I showed you the X-ray picture, inferior dislocation of shoulder. It injures the axillary nerve. Since it injures the axillary nerve supplying structures will be paralyzed. That is your deltoid. Deltoid produces 15 to 90 degree of abduction. So that will be lost. So the person is not able to do the abduction beyond 15 degree to 90 degree. And the next is loss of sensation over the skin or over the deltoid. It means upper lateral cutaneous nerve of arm is also compromised. See, these are the important points